And now we'll get started with our Director of Workforce Transformation, Diane Hank.
Good morning, afternoon, everyone. Thanks for joining us today for info session number 12 for MSCs. Wanted to remind you that sessions 1 through 11 are currently all posted on the OPWDD website. You can download the entire presentation or the slide decks from the presentations. And I wanted to explain that for the next 2 sessions, we have yet to finalize the topics. The reason for that is that we're trying to be very responsive to the feedback that we're getting from the field. And so while we have a number of topics ready to go, we are going to wait until we announce this time, a little bit of time, so that we can finalize what the need is, what topic areas need to be covered most. That was the reason for selecting the topic that we did for today. So if the website information is there on the slide, if you need to go there to either register for future sessions or to look at any of the current sessions, you may do so. As you know, the information sessions do count toward professional development hours. One other technical side note I'd like to make before I hand the presentation over is that we may be sensing a little bit of audio trouble here today. So if you are listening and can mute your phone on your end, that will doubly ensure that we don't have any problems with extra noise coming in on the lines. We had a little bit earlier that we were trying to pinpoint, and we think we have, but that would help us to avoid any background noise that may be coming from people talking or using their keyboards. And so now we'll begin our presentation today. It's answers to MSC questions, the ones that are most frequently asked, and I'll hand it over to Allison McCarthy from the Division of Person-Centered Supports.
Thanks, Diane. So again, we're really just focusing today on the questions that we received over the last several weeks. We wanted to be sure to address the immediate questions, and then, as Diane mentioned, we can turn to additional topics in the coming weeks. To review resources that are available for Medicaid service coordinators, we have our training that is available on the statewide learning management system. It's called What MSCs Need to Know and Do. So this is an important resource that I'm hopeful that you've all familiarized yourselves with, but this is really where the information is at, and I think MSC Toolkit is available there under resources, as well as on the OPWD website. Included in the toolkit is the MSC or CCO Health Home Brochure, the CCO coverage chart, an example of script and guidance, FAQs for individuals and families, FAQs for MSCs, the sample letter that has gone to individuals, as well as a video called Care Coordination Sample Information Session. So again, the SMLS resource page is critical, and we also have information available on the website. So in addition to those resources, we currently have our webmaster who posts information to the OPWD website working on adding MSC frequently asked questions. So that information should be available shortly to you all. It's really representing many questions that have come in over the last few weeks from MSCs, MSC supervisors, and others on how this is all going to work. The FAQ includes topics of consent and decision-making, and again, this should be available shortly to you all. The information that we've included in today's training session is covered in this FAQ document that will be posted. We've also mentioned last week that we'll be providing a step-by-step guide to MSCs. This is a guidance document to instruct MSCs on a step-by-step process for enrollment and consent. This is intended to be a quick guide for you all to use while completing the enrollment process and provide easy access to resources. This too will be posted on the OPWD webpage. So now we're going to turn to some questions that we received over and over again. So as you are aware, as a care manager and a care manager who's going to continue to deliver services to individuals with developmental disabilities, you may be working for your MSC service provider on July 1, but you also may be working for the CCO. So we've received a question on salary and benefit information, and if you do want to talk to a CCO about salary and benefits, here are the main contact numbers. So for Advanced Care Alliance, Prime Care Coordination, Care Design, Person-Centered Services, Tri-County Care, Life Plan CCO, and Southern Tier Connect. You may reach out to the CCO directly to learn more about what it means for you to work directly for a CCO. Here's another question that we've received many times. What if a person doesn't want health information shared with anyone, including the CCO? There are two levels of information sharing. To enroll in a health home care management, a person must agree that personal health information at a minimum is shared with the care manager, the person's physician, and if enrolled in a managed care plan, with that managed care plan. This information is secure and can only be shared in relation to the person's service needs. This sharing of information supports comprehensive care management and allows for care managers to receive alerts when an individual is hospitalized. The next level of information sharing relates to a person's life plan. The life plan, like the individualized service plan, must be shared with all Hcbs waiver providers and others as directed by the individual. In both cases, the sharing of information is something that happens today. So whether it's level 1 that I talked about or 2, information about an individual is shared with providers to support the individual's needs. It's not that different than what we do today for MSC in the delivery of Hcbs services. So health home information sharing is not required for basic Hcbs plan support. So if you decided that you do not want to share your information between your care manager, your physician, and your managed care plan, then you may enroll in basic Hcbs plan support. As part of the person-centered planning process, the person may decide whether certain types of information can be shared with other people who participate in the life planning process. We also received some other questions related to the consent forms. If a child turns 18 years old between now and June 30th, 2018, which consent form should they sign? If an individual will be turning 18 years of age before July 1st, they should sign the DOH 5055 adult consent form. When a child who is enrolled in the CCO turns 18 years old, will they be required to complete the DOH 5055 adult consent form? So yes, they'll have to complete the 5055 when they become an adult. The adult consent form must be completed within the month of the child's birthday to ensure continuity of care management services and the ability for such services to continue. So this is another question that we continue to receive. How does an MSC determine if an individual is able to make decisions to enroll in a CCO? So just like today, individuals make decisions or may be supported when making decisions. So it's kind of the same way it works today. Through the person-centered planning process, MSCs should work with the individual as they do today to support and recognize his or her ability to make decisions. If the individual makes decisions on his or her own in other areas, such as service choices or healthcare choices and decisions, they would be able to make their own decision on choice of CCO. So what documents need to be sent to the CCO? A lot of questions on these documents. So the MSC must complete the CCO selection form and choices. So when an individual makes the choice of a CCO and makes a choice of the care management service, the Medicaid service coordinator enters into choices using the CCO selection form that information. In addition, the documents that describe these documents that are listed on this screen need to be included in the individual's record. So the completed and signed consent forms, the individual's current individualized service plan, if completed, this current state-approved assessment summary coordinated assessment system, or the DDP-2 or the Developmental Disabilities Profile 2. In addition, if the person is enrolled in the Hcbs waiver as available, the initial and current level of care eligibility determination, LCED we often refer to it as well as related documentation including supporting evaluations. So these documents need to be maintained in the individual's record by the Medicaid Service Coordinator. If the Medicaid Service Coordinator is transitioning with the individual to the CCO, it's fine to keep that information in the record and work with your MSC provider to determine how that is maintained. I will talk a moment about what happens if the individual is selecting a CCO that is different than what your Medicaid service provider is affiliated with. But before doing that, I just want to touch on a common question related to ICF level of care eligibility determinations. So what happens if the LCED is not available in the person's record? So basically, if it's not available, you do not need to include it. But if it is available, please include it in the individual's record. At the time of implementation, the CCO will need to work with its MSC affiliates or care managers to basically collect information that supports the individual's level of care and the ICF level of care eligibility determination. So again, we're going back to if the individual is selecting a CCO that is not the same as who your MSC affiliated agency is with, documentation needs to be sent to the selected CCO. And this is a list of contact information, including addresses, that has been provided by the CCOs to indicate where information should be sent. So a name, a number, and addresses, and you can work with your MSC supervisor and administrative leadership to determine how to best move the documents to the CCO that the individual has selected. Can documents be shared with the CCO through choices? Yes, documents may be shared and uploaded to choices. It is not an OPWD requirement. The documents will not be transferred directly to the CCO via choices. So the CCO will have the ability to look into choices, but it won't happen automatically. The documents will remain part of the person's record within the choices system and can be accessed by authorized users of the person's records. After the July 1, 2018 initiation of services, the CCO will be able to access this information via choices. So again, as I mentioned, it won't happen automatically, but that collection of information about the individual in the individual's specific record will be available only to staff who have authorized access to that information. What is the time frame to change ISPs to life plans? So the time frame for completion of the initial life plan for all individuals transitioning to CCOs is at least 6 months and no more than 12 months from the start of CCO services. So for tiers 1 through 3, an MSC has up to 12 months to complete the life plan. For tier 4, the life plan must be completed before the 6-month mark. The life plan will be implemented using the individual's regularly occurring cycle of ISP meetings. For individuals who enroll into a CCO after July 1st and who have not received Medicaid service coordination or plan of care support services, the initial life plan must be completed within 60 days of CCO enrollment. So, for example, if somebody is just coming into the program, a life plan must be completed within 60 days. On the checklist, it states that we should schedule a life plan review. Is this different from the semi-annual and annual review dates? To initiate a smooth transition into CCO services, care managers will be required to complete a checklist, either in person or over the phone between now and July 31st, 2018. The development of the initial life plan will, in most cases, follow the person's established schedule for annual care plan meetings. This meeting could be either the person's semi-annual or annual review based on their established care plan schedule. I just want to make note that if you do complete the annual review meeting at the annual review date, that 6-month meeting still has to occur. So you still need to meet and review the person's plan every 6 months so that if audited, that is on record to having conducted both an annual and a semi-annual review. What happens to individuals who are newly eligible for care management services and are not yet receiving MSC or PCSS? Medicaid service coordination providers should work with the individuals to educate and inform them of their choice to enroll in the CCO. If eligibility hasn't been determined, the provider must contact the DDRO front door office, and provided on the screen is the link to the contact information for front door contacts. How should we handle transition for people in non-Medicaid service coordination? So again, some people who do not have Medicaid or are not eligible for Medicaid service coordination, in some cases may receive non-Medicaid funded service coordination. Any person currently receiving state-paid Medicaid service coordination, including Willowbrook individuals living in Isps and nursing homes, will be enrolled in non-Medicaid care management, a service that will be provided by the CCO. A CCO enrollment form and choices does not need to be completed for individuals receiving state-paid care management. TABS program codes are being created to enroll and track individuals who will receive state-paid care management. OPWD centrally will be transitioning individuals into the program codes being established. So individuals who currently are receiving non-Medicaid service coordination will be transitioned by OPWD central office to a TABS program code that will be under the CCO, and those CCOs will be notified of those lists of individuals. It is a very small group at this point. So those were the really high point questions that we wanted to share with you and provide some clarity. Now we have some time to take questions that you've submitted via the Q&A on the PowerPoint.
So we'll begin with a question regarding the consent, and an individual asked, will a new informed consent be signed if cases are being transferred or assigned to a new care manager?
The question is, will a new consent need to be signed if an individual transitions to a new care manager? The answer is no. For care management, for a new care manager, you're still receiving and are enrolled in that specific CCO. Now, if you decide to select a different CCO, you would need to withdraw from your current CCO and then enroll and consent with that new CCO. So again, not needed for change in care manager, but it is needed for care in or change in a CCO choice.
In regards to information sharing, if parents can choose to share information with the CCO and the care manager, or with only the Hcbs providers, where should they document this on the consent form?
So the consent form, the health home consent form, includes a section, I believe it is the last page of the consent form, and some of the training materials that we provided walk through the specific sections and fields in the form. But if you are adding your care manager or CCO name and your Hcbs provider name to that section of the form, which is, I believe, the third page. It has lines where you list those, the names of those providers.
In order to receive health home care management, does the person have to consent to sharing information with a REO?
So in order, when you consent to enroll in the health home care management program, you are consenting that information is being exchanged between your CCO and their the REO that they're affiliated with, or REOs that they're affiliated with. So you do need to, you are attesting and consenting to that information being shared. Now, the benefit of that is that if alerts are available regarding an individual's entry into a hospital, that information is automatically shared to the CCO, and then the care manager will get an alert that states such. So, you know, the idea behind health home care management is that it is a way to support information being shared between the service providers that are already included in that REO system and our care coordination organizations.
Now we're going to move into a question regarding the life plan. When referring to the current ISP, does this include all ISP attachments, including the Ipop or other plans, or is it just an ISP?
The ISP attachments should be included. So your Ipop, HAB plan, those should be included in the package that is shared or retained with the CCO.
A previous slide said that the transition from ISP to life plan must be at least 6 months, but no more than 12 months from 7/1/18. Does that mean we are not allowed to transition an ISP to a life plan any earlier than 6 months?
No. So for individuals who are, you know, who need a life plan review or a person-centered review, the day they enroll, say July 1st, into the health home, if that is needed and requested by the individual, an individual may request at any point a person-centered planning review. That life plan could and should be developed at that time. So the 6 months and the 12 months is really just the latest. So apologies if that was not made clear in that screen. That is the furthest out that life plan can be completed. For Tier 4, it's 6 months. For the other tiers, it is 12 months. But based on the request of the individual or the needs of the individual, that person-centered planning review can occur at any time and should occur if needed, which would establish the life plan at that point.
For people who have ISP reviews that are due in July, would they be doing life plans or ISPs?
For your July review, you can choose, if you're an individual and you would like for that comprehensive assessment to occur and the development of a life plan to occur, you may choose so. If that is not preferred, you will have the 12-month period to complete the life plan review. So in July, you could choose to conduct a 6-month review, and it would not necessarily need to be that comprehensive life plan review that would result in a life plan, full life plan. So it's really up to the individual to determine what the preference is, but all CCOs will be trained and in a position to conduct that comprehensive assessment and establish a planning opportunity with the care team and approve a full life plan.
So just to clarify, the life plan has to be completed by the next meeting date, no matter if it's an annual or a semi-annual meeting?
So to clarify, for tiers 1, 2, and 3, the life plan can be completed at the annual review date. So, for example, if you have, your annual review date is in April, and you just had that conducted, you will have through next April to complete that life plan. You could make a decision to have that life plan completed at the semi-annual review. And I open it up to others in the room if you would like to clarify further.
Nathan?
For the care manager checklist, what date should we include as the meeting date? Would it be the next ISP review date or life plan review date?
That's a good question. So the checklist requires that you basically identify the date of the review that you will be conducting your full assessment and establishing the life plan. So it would be, if you have a semi-annual review date between that and your annual review date, I might just put both dates so it's clear to the care team. It's basically documenting in the individual's record when your upcoming semi-annual and annual review dates are. So if you are holding and plan to take the full year to complete that plan, you could identify the semi-annual review date and then that annual review date that will be the full life plan development. But again, it's important as an MSC to have a conversation with the individual about their preference. If at the 6-month mark, the semi-annual review, they would like that full comprehensive assessment to occur and establish the life plan earlier and, at that time of their choice, then, that's how it should be handled. It's at the discretion and preference of the individual. But again, I would identify both dates if you had them established, and if it's just one semi-annual review date, you could identify that date on the checklist.
Does an individual receiving non-Medicaid service coordination through an FSS grant fall into the category you just spoke about regarding the state-paid service coordination?
It's a great question. So family support services contracts that are providing care service coordination does not fall into that category. So we have, that is a contract vehicle versus what I spoke about is our voucher processing system, and those are price IDs in that system that are supporting some Willowbrook individuals living in ICFs as well as nursing facilities and some other individuals who are not eligible for Medicaid service coordination. But the family support service contracts will continue, and those are separate and apart, but nothing is changing related to those family support service contracts at this time. So they will continue to be in place.
What is the enrollment process for individuals, Willowbrook, So could you please go over the procedure for Willowbrook class members in that enrollment process?
So today we have individuals who are who are Willowbrook individuals living in ICFs and in nursing facilities. So because they're in those settings, they're not eligible for Medicaid case management. I have identified and we know who those people are. So the OPWD centrally will be transitioning those individuals to the CCO and establish in our tab system those program codes. If individuals who come forward later and are Willowbrook and live in an ICF, you would work as you do today with your DDRO front door and DDRO to establish the enrollment into the program for a Willowbrook person who's living in an ICF. So it continues to be operationalized through your DDRO like it has been previous, and there's no change with that. So we're transitioning everyone who's in that program today over to CCO, but any additional adds to those programs would be, as they are today, established by the regional office.
If a person enrolls in the basic Hcbs plan support, do they need to be enrolled in the waiver?
No. Individuals, health home and CCO eligibility for care management is based on criteria. The criteria is Medicaid eligible, DD eligible, so OPWD eligible, as well as ICF level of care. So your ICF level of care eligibility determination is what establishes, in addition to Medicaid eligibility and DD, so the three-step DD process, your eligibility to receive either health home care management or basic Hcbs plan support services. So you do not need to be enrolled in the waiver. You need to be eligible based as I just described, those three criteria. In addition, you cannot be living in a setting that is not allowable for Hcbs services.
Can you please review when the CCO choice selection in choices is completed?
So as soon as an individual makes the choice and signs a consent form, that CCO, that choices selection screen, it can be entered. So you may want to coordinate with your supervisor or your MSC provider to as to how you're going to enter that information, whether it's done in batches or you can go in at any time, but there's specific people in your organization who have access to that choices selection screen. So if you are that individual or you're handing it to the administrative staff who have that, it's at any point following that consent being signed.
Individual DDP2s and CAS assessments are already in choices. Do they need to be uploaded again?
They do not need to be uploaded if they are the most recent and they are the current documents. So if an individual has had the CAS and their summary is already in choices, you would not need to upload it if it's the same summary.
When you refer to the DDP2 being uploaded to the CCO or shared with the CCO, do you have to include the forms with the ISPM scores?
Good question. I would, to be safe, include the information that you have, the DDP2, as well as any other available information that's considered a part of that document. I mean, really what you're providing in terms of moving those documents to the CCO is the set of information that they will use to conduct that full comprehensive assessment and eventually establish that full life plan. So in my mind, you can't include too much information. It's always better to err on the side of sharing that information and providing that in the individual's record because it's useful, and you know, too much information I don't think is an issue. It's only if information is not included. So
Could you please clarify, does the checklist need to be completed for the individuals who choose the basic Hcbs plan support service option?
No, the checklist does not need to be completed for someone who enrolls in basic Hcbs plan support.
Is the checklist available, and if so, where can it be located?
The checklist is available on SLMS. Is it also on the web? It's in SMLS within the toolkit. And your MSC providers have all received all of these documents. So you should maybe reach out to your supervisor to see if you can access the form through your supervisor.
In the SLMS, it's under the resource section.
So in the SMLS, it's in the resource section. So that link was shared in a previous slide. And this PowerPoint will be posted later in the week, and that link is also available in a series of other trainings that we provided, including the training mentioned earlier, MSCs and how to transition.
Can a child that receives early intervention and currently receives plan of care support services enroll in health home care management?
The question was, can an individual who is receiving PCSS and enrolled in early intervention enroll in the CCO health home? My understanding today is that individuals who are in EI and receiving service coordination are receiving that service coordination through our non-Medicaid service coordination program. So if they today are receiving non-Medicaid service coordination, that would fall into the group I mentioned earlier that will transition to the CCO, and OPWD is establishing those program codes to move the individual under the CCO responsibility under a TABS program code, and the state will do that centrally.
Could you just please re-review the life plan completion timeline for Willowbrook class members?
So for Tier 4, the life plan must be completed no later than 6 months. So it's expected that for Willowbrook, everyone who is a Willowbrook class member has a life plan in place no later than December 30th, 2018. Again, it is the choice of the individual to dictate when a care planning review and comprehensive assessment should occur. So again, if that's the choice of the individual to have that completed earlier, then the CCO care manager should support that request.
On the consent forms, do we need to include OPWDD on the list of providers on page 3? This is the DOH 5055, the adult consent form.
And what is the
Do you have to identify OPWDD as one of the providers?
If you are receiving state-operated services, then yes, you may add OPWD state-operated services to that consent form. So just like any other provider, if you're receiving state-operated services, that information is shared today across those providers and may also be shared as you enroll in the CCO health home.
And continuing off that, for the DOH 5055, for the list of participating partners, do we list all providers that are currently listed in the ISP or only the health providers?
So there's a minimum standard for the 5055 in terms of what providers need to be listed. Your primary care provider, your care coordination organization, and if you're enrolled in a managed care plan, a mainstream managed care plan, you would add the name of the plan to that form. Those are the only requirements. Now, it makes sense, and you may want to add the Hcbs providers and other providers that currently provide supports to you, because then that's just authorizing that information to be shared across providers. But again, as I mentioned earlier, through the life planning process and the development of the life plan, there's also a section there for your Hcbs providers, so that too supports the sharing of information on that second level of information sharing that I talked about earlier. So it's really up to you, but again, there's only certain requirements for the DOH 55 if you prefer not to add any other providers other than your care management provider, your CCO, your primary care provider, that's okay.
If families do not wish to have their children's medical information shared, would they be eligible to receive the health home care management services?
So when you enroll and you complete the 5055, which is the health home consent form, you're required to add your primary care physician and your CCO, so your care management provider. That is who information is being shared with, and it includes the information, the sharing of information with the Regional Health Information Organization Network. So it's a system that basically can provide alerts to and from your CCO, and that's really one of the benefits of health home care management. So if that's not of interest to you and you do not want that information being shared across that information sharing network, then you might choose Hcbs basic plan support. But again, it's not that different than today. Under HIPAA and under, when you choose to receive a Hcbs service, you are today sharing information with providers. It does add your primary care provider when you enroll in a health home, but you know, the benefit is that we're trying to achieve an integrated care model where information about your health can be shared to and from, so that providers can better meet your needs.
Can consent forms be amended at any time?
Well, consent forms cannot be amended. If you want to change your decision, then you can basically disenroll from a program and enroll in a new program and consent to that new program. So, you know, the question was a little bit confusing in the sense of you don't amend consent forms necessarily, but you can move in and out of programs as you choose. If you have an additional provider that you want to add to your consent form, you can add that provider and initial it. If you want to take off a provider, you could cross out that provider and initial it and date it, so that, you know, if reviewed, it's documented your addition of providers or removal of providers.
The CCO checklist states that care managers will assist in comprehensive transitional care, one of the 6 core health home services. Can you provide some more detail about what comprehensive transitional care entails?
A common example of transitional care would be if an individual is in a hospital setting and they are then discharged back to their home. There is a transition plan for that discharge that the hospital is required to provide. So the care manager would be supporting and ensuring that that transition plan has been completed, and then continually follow up with the individual once they leave the hospital setting in their own home. So it's really being able to make sure that when an individual moves from one setting to another, that the supports and services to ensure that transitional care is addressed. So, you know, in addition, it could be transitioning from school age to adult services. So, you know, when we talk about individuals with developmental disabilities, it could be related to a hospital transition, or it could be related to a school age transition, and the CCO and care managers are being trained to understand that dynamic and to understand their responsibility that they have when an individual has that type of transition. So the policies and procedures that are being developed by CCOs need to address those various examples of transition.
Could you please clarify for the children's consent forms, does the school need to be identified?
The school doesn't need to be identified on the children's consent form. You could identify that if preferred, but we will be taking a closer look at school services and our and how CCOs and our school systems interact. It's one of those areas that, following our initial transition, we'd like to be able to, you know, provide more guidance and, you know, improve and support that relationship development.
We received a lot of questions about the care management tiers, what they are, when people will find out, what tier people on their caseload are in. Is there any clarification you can provide about the tiers?
So the tiers is really a methodology for administrative methodology for the CCO to be reimbursed for the varying levels of need and the varying amount of time that a care manager might have to support a person. So it's less impactful to you as a care manager, because regardless of the tier someone falls into, you have a responsibility to address the individual's needs on an ongoing basis and as needed. So CCOs will know and have information about individuals and their tiers in July, but I want to stress that it's really a financing methodology and has less to do with how a care manager addresses the individual's day-to-day, monthly, ongoing care needs. Level 4 is the highest level, and then we have 3, 2, and 1 going down in terms of level of need. Your CCO can provide guidance and information as they've outlined in their policies and procedures, and to train you as care managers. But again, I leave that to the CCO because it's a methodology, an administrative methodology component that is less pertinent to you as a care manager providing comprehensive care management to individuals.
I think we covered a lot of the questions that we received today. And again, the FAQ is in the process of being posted to the OPWDD website, and I think that will provide a lot of clarity. So we advise that people refer to that.
Great. So thank you, everyone, for your participation today. We appreciate it. By the questions being asked, a lot of information has been absorbed, so that's great news. Our enrollment numbers are continuing to increase, which is great news, so we appreciate your continued support and interest to become educated about the transition, and continue to push your questions forward. On the screen right now is the address for submitting questions, care.coordination@opwd.ny.gov. We encourage you to submit anything that hasn't been clarified by the FAQ and other resources, and we'll be pushing out that resource guide in the coming days or week, hopefully. So again, thank you for your time, participation, and continued dedication to the individuals you serve.